In 1859, the fog-choked streets of London held a dark secret. A respectable woman, Mrs. Whitmore, sought solace from a tormenting invisible enemy. Anxiety, insomnia, a gnawing irritability, and what she delicately termed nervous episodes. Her physician, a pillar of Victorian medicine, peered through his spectacles and with chilling certainty pronounced her afflicted with hysteria. His prescribed cure? A treatment so shocking, so utterly bizarre, it would shatter modern medical ethics. He would lay her on his examination table and with his own hands manually stimulate her genitals until she achieved what he clinically recorded as hysterical paroxysm, an orgasm. This wasn't some back-alley charlatan. This was the gold standard, performed by esteemed doctors in the grand clinics of Europe and America. For 2 millennia, the phantom disease of hysteria had plagued women, its origins a mythical, wandering womb. But by the Victorian age, the cure had become a grotesque, unwitting ritual. Doctors were literally giving women orgasms as therapy, completely oblivious to the explosive truth of what they were doing. This is the jaw-dropping, mind-bending story of how Victorian sexual repression was so absolute that it forced physicians to invent the vibrator, all to save their aching hands from a daily deluge of hysterical women. And they never, not once, grasped the reality. Before we plunge deeper into this medical madness, let's understand the twisted roots of hysteria. Its whispers began in ancient Egypt, but it was the Greek physician Hippocrates who branded it. Hystera meant uterus. And these ancient men believed a woman's womb was an unruly beast, an animal within an animal, as Plato described it, desperate for children. If denied, it would wander through her body, a rogue organ pressing on vital parts, conjuring everything from anxiety to sudden fainting. The chillingly simple solution: marriage, pregnancy, to satisfy the restless organ. By the Renaissance, the wandering womb was dismissed as anatomical nonsense. But the diagnosis? Oh, it clung like a phantom limb. The symptoms of hysteria ballooned, swallowing every female complaint: nervousness, sleeplessness, muscle spasms, breathlessness, loss of appetite, depression, even sexually forward or sexually repressed behavior. Essentially, if a woman wasn't a perfectly docile, silent ornament, she was hysterical. Dr. Thomas Sydenham, an English physician, grimly estimated it was the most common disease after fever, afflicting 1/4 of all women. The Victorians inherited this medical ghost, adding their own layer of suffocating repression. They saw women as delicate, fragile creatures, their entire being dominated by their reproductive systems, making them inherently weak. Dr. William Acton, a titan of Victorian medicine, famously declared in 1857 that the majority of women, happily for them, are not very much troubled with sexual feeling of any kind. This wasn't just a belief, it was a societal dogma. It created a colossal, impenetrable blind spot. So when women riddled with what we now recognize as sexual frustration presented their suffering, doctors saw only disease, never desire. The treatment that bloomed from this ignorance was pelvic massage, meticulously applied to induce hysterical paroxysm. We know it as orgasm. But to them, it was a purely clinical event. Dr. Nathaniel Highmore, as early as 1660, described it as causing violent contraction and relaxation of the muscles, accompanied by flushing of the face and a feeling of relief from symptoms. Imagine the scene. A woman, often weakly, entering the hushed antiseptic office. She would recline on an examination table, partially undressed, yet draped in a sheet for the sake of modesty. The doctor, a man of science and reputation, would apply scented oils, lavender, rose, to her vulva. Then the rhythmic circular motion would begin. Medical texts, stark and unblinking, instructed him to continue until the patient reached paroxysm, sudden muscle contractions, flushed skin, and copious vaginal lubrication, followed by profound relaxation. Dr. Russell Troll, in 1903, would lament the arduous nature of this duty, complaining it could take over an hour and was the most tedious and demanding of medical procedures. A chore, an exhausting medical necessity, never sexual, as clinical as setting a broken bone. One physician actually penned a complaint that it was hard work to the physician, requiring 1 to 1.5 hours of the doctor's time. This wasn't a niche practice. It was an epidemic. By the late 1800s, doctors gasped that up to 75% of American women suffered from hysteria. In teeming cities, entire practices specialized in this single affliction, seeing dozens of women every day. Dr. Taylor's New York clinic promised complete relief from nervous exhaustion and female troubles, employing multiple doctors to meet the surging demand. Appointment books from the era show women scheduling weekly, even bi-weekly sessions, often for years. And it wasn't just in sterile offices. Wealthy women enjoyed discreet house calls. But the most fashionable, most popular solution was hydrotherapy at specialized clinics. Picture this: elegant European spas, places like Bath in England or Baden-Baden in Germany, transformed into centers of medicalized sexual release. Women would spend weeks taking the waters, receiving multiple treatments daily. They sat on specially designed chairs, cutouts revealing their genitals, while attendants, with clinical detachment, directed high-pressure water jets at them. The French, ever so poetic, called it la douche pelvienne, the pelvic shower. An 1875 Baden-Baden advertisement, dripping with Victorian euphemism, promised complete restoration of feminine vitality through the scientific application of thermal waters. Women reported feeling invigorated and restored to full health. They were, of course, having orgasms multiple times a day under the guise of medical treatment. Then, in the 1880s, fate intervened through the cramping hand of Dr. Joseph Mortimer Granville. His fingers ached. His wrist throbbed. Manual pelvic massage was an agonizing grind, especially when some women needed over an hour to reach their paroxysm. His solution? A stroke of unwitting genius. He invented the first electric vibrator. Granville's percussor harnessed the raw power of electricity to create rapid mechanical vibrations, slashing treatment time from an hour to mere minutes. He, in his own blind spot, insisted it was for male muscle disorders. But the medical world, desperate for relief from the tedious chore, saw its true unacknowledged potential. Within a decade, the market exploded. Dozens of vibrator models flooded clinics. The Weiss Company catalog of 1906 showcased over 20 different devices, each promising efficiency. The Chattanooga vibrator boasted relief of hysteria symptoms in under 10 minutes. By 1900, this medical device was the fifth most common electrical appliance in American homes, nestled in household catalogs right alongside toasters and sewing machines. The 1908 Sears catalog advertised a home vibrator as very useful and satisfactory for home service. The advertisements were a masterclass in Victorian doublespeak, explicit in their promise of relief, yet scrupulously medical. One 1910 ad showed a serene woman using a vibrator on her face proclaiming, "Vibration is life. The secret of the ages has been discovered in vibration. The White Cross electric vibrator brings the essence of life itself to your very door." But here's the truly mind-boggling, almost infuriating paradox. Nobody, not the doctors, not the manufacturers, not the advertisers, seem to grasp the sexual nature of these treatments. Doctors published detailed clinical papers on inducing hysterical paroxysm without ever linking it to sexual climax. Why? Because Victorian medical education had systematically erased female sexuality. Textbooks barely mention the clitoris, if at all, often dismissing it as a small vestigial organ of no particular function. The willful ignorance was a vast, gaping maw. Dr. John Harvey Kellogg, yes, the serial titan, ran a sanitarium where he used vibrators to treat hysteria, even as he thundered against masturbation as a dangerous evil. The cognitive dissonance required to maintain this delusion is truly staggering. Physicians spent their days giving women orgasms, then returned home to wives they genuinely believed had no sexual desires whatsoever. Yet some women, in the quiet solitude of their diaries, hinted at the truth. They couldn't articulate it in explicit terms, not in that era, but they felt it. One anonymous woman wrote in 1892, "My weekly appointments with Dr. Harrison have quite restored my spirits. I find myself looking forward to Thursday afternoons with great anticipation." Another noted, "The treatment, though peculiar, provides relief unlike any tonic or medicine." They recommended their doctors to friends, creating silent networks of women who all received the same peculiar treatment, seeking that elusive relief. The medical establishment's profound blindness to female sexuality had consequences far darker than mere ignorance. Doctors performed brutal clitoridectomies to cure masturbation. They cauterized the clitoris with acid to prevent self-abuse. Dr. Isaac Baker Brown, president of the Medical Society of London, horrifyingly removed the clitorises of patients as young as 10 to treat hysteria. He was eventually expelled from the society not for the barbarity of the procedure itself, but because he operated without consent. Meanwhile, the hysteria industry exploded. By 1915, American doctors were raking in an estimated $18 million annually from hysteria treatments, over $450 million in today's money. Manufacturers churned out increasingly elaborate devices. The vibratile from 1908, with its multiple attachments, the hand-cranked Pulsocon from 1890, even special treatment chairs with built-in vibrating mechanisms. The beginning of the end arrived with Sigmund Freud. Flawed as his theories were, Freud at least dared to acknowledge that women possessed sexual desires. He posited that hysteria often stemmed from psychological, not physical, causes. By the 1920s, the American Psychiatric Association began quietly retiring hysteria as a diagnosis. But the true death knell came from a source no one could have predicted: early pornography. In the Roaring '20s, stag films began appearing, depicting women using vibrators for explicitly sexual purposes. Suddenly, the respectable medical device, once advertised in genteel magazines, was tainted, branded with undeniable sexuality. Vibrators vanished from doctors' offices almost overnight. The Sears catalog dropped them by 1925. What had been a common, accepted medical treatment became a scandalous taboo. Doctors quietly abandoned pelvic massage, and those dusty vibrators in medical cabinets were discreetly disposed of, their true purpose finally, terrifyingly revealed. The diagnosis of hysteria officially vanished from medical texts in 1952, but its insidious legacy lingered. Women's legitimate medical concerns still often dismissed as hysterical or emotional. It wasn't until the 1960s, with the groundbreaking research of Masters and Johnson, that female sexuality was finally studied with scientific rigor. They confirmed what those Victorian women had known in their bones but could never utter: that the hysterical paroxysm doctors had been inducing for centuries was simply an orgasm. Looking back, the entire episode is almost unfathomable. How could trained medical professionals, the most respected minds of their era, not recognize an orgasm? How could they perform explicitly sexual acts daily, believing them to be purely medical? The answer lies in the terrifying power of cultural blindness. Victorian society's absolute, ironclad denial of female sexuality constructed a reality so warped that doctors could literally give women orgasms all day long without ever seeing the obvious truth staring them in the face. Dr. Rachel Maines, whose pioneering research unearthed this history, perfectly captured the chilling irony. Victorian doctors were inadvertently providing the only sexual satisfaction many women received, all while believing they were treating a disease caused by a lack of sexual satisfaction. The women who lined up week after week knew something their doctors didn't. That hysterical paroxysm was the solitary bright spot in lives otherwise starved of sexual pleasure. The scale is truly staggering. Over 70 years of peak hysteria treatment, roughly 1850-1920, millions of women received regular pelvic massage. In major cities, some women visited their doctors weekly, even bi-weekly, for decades. If we conservatively estimate that just 10% of adult women receive treatment, averaging 20 sessions each, that translates to tens of millions of medically administered orgasms, all performed by doctors who had absolutely no idea what they were doing. This isn't just a bizarre historical footnote. This history matters because it rips back the curtain on how completely medical practice can be twisted, warped, and perverted by cultural assumptions. These weren't quacks. They were the most respected physicians of their era, trained in the finest medical schools, following accepted protocols. Yet, they were so utterly blinded by their culture's denial of female sexuality that they couldn't recognize the most obvious truth, literally at their fingertips. So, the next time someone dismisses a woman's legitimate health concern as hysteria or emotional, remember this. For centuries, the medical establishment was so profoundly ignorant of women's bodies that they accidentally invented vibrators while trying to treat a made-up disease. They were so convinced women had no sexual desires that they couldn't recognize an orgasm